Rebuilding your dental practice after COVID will be unlike any other management challenge you have ever faced. Your patients have new, deeper fears that go way beyond just health safety. Would you like a step-by-step plan of simple gems that you can deploy today to help you accelerate your recovery? That's exactly what we're going to do in this new series, and we're starting with 5 gems right now.
And now, Amazon #1 best-selling author, Dr. Tom, the Gems Guy, Orent.
Greetings from Planet Gems. I'm Dr. Tom Orent, aka the Gems Guy. Welcome to the Dental Goldmine. Whether you've been with me for decades or maybe this is your first time here on the planet, if you want simple, effective action plan to guide you on the road to recovery, you are in the right place. Be sure to watch the entire video so you don't miss one simple change which you can make to absolutely maximize your productivity. In this video, #1 of the series, we're going to cover 5 gems. Your road back isn't going to be easy, but you already knew that. I've always considered myself a realistic optimist. I focus on the positive and I avoid wasting my time and energy on the negative over which I have absolutely zero control. So let's jump right in and focus on recovery accelerators over which we do have control. Gem #5, those who rebuild the fastest will have this mindset that I call patient centricity. Write down patient centricity. I know you've always been focused on doing the very best you can for each and every patient. I'm sure you've built a great relationship with your patients as well. I don't doubt that. I'm sure you give them the very best possible care. We all agree, but what you've done in the past, it won't begin to address their 2 biggest fears that go way deeper today than what disease or safety issues might I be facing in a dental practice. Patient centricity requires that you enter the conversation that they're having in their minds right now. Identify their greatest fears and address them head on. Deploy what you're about to discover in this series. You'll not only bring back more of your existing patients, you'll measurably increase case acceptance. You might even open up a brand new deep vein of new patients. Too good to be true? No, it's not. But remember, I already said, it's not going to be easy. But the good part is, most of your local competition won't be willing to do these things. Gem #4, patient fear #1, loss of their jobs. I'm not talking about surgeons and CEOs and attorneys. I'm talking about your 9-to-5 workers who may be deeply concerned about leaving work to go to a dental visit. Unemployment is going to remain at levels unlike anything we've seen since the Great Depression. Many patients who had no trouble leaving work to come to a dental practice pre-COVID may be thinking twice now about that. Understanding their fears lets you be proactive, which leads me to gem #3. But first, if you're watching this before Thursday night, April 30th, use the link in the description below and you can attend my live 90-minute webinar, Your 6-Week Plan for a Rapid Recovery. I'll continue to work hard on this series, but during the 90-minute live event, you're going to get a ton of gems you need for a rapid recovery all in one sitting. Now, if it's after April 30th, you can still get access to a replay of my 90-minute webinar, A 6-Week Plan for Rapid Recovery. Elizabeth and I would be delighted to have you with us for a free 6-week test drive of GEMS Platinum membership. Go to dentalgoldmine.com. There's a link in the description below. When you start your free test drive, ask your concierge for access to the 90-minute 6-week Rapid Recovery webinar. Gem #3, offer appointments during all 3 possible lunch hours. 3 lunch hours? Well, it's a fact that there are at least 2 times that people typically will break for lunch. The noon hour, which is 12 to 1, and the 1 to 2 p.m. Although there's a smaller percentage of people, some folks do like to take an early lunch at 11 o'clock. When you open your office from 11 a.m. to 2 p.m., you're maximizing opportunities for your patients to be visiting during their lunch hour and not missing work. If you find this helpful, please click like and share this video with other dentists. And don't forget to subscribe to the channel so you won't miss a thing. Also, hit the bell notification so that YouTube will notify you when I release my next video. Gem #2, so when do we take lunch? You don't. Well, not exactly. Ask yourself this question. What happens during the hour immediately before lunch and during the hour right after lunch? As we approach the lunch hour, doctors and team may be thinking more about lunch than staying highly productive. After lunch, of course, there's brushing teeth, brushing hair, using the restroom, generally not able to get back up to maximum speed for quite some time. The hours before and after lunch, and of course the lunch hour itself, are 3 of the least productive hours in your day. Gem #1, the straight 7 schedule. Here's the productivity gem that I promised earlier. It's my thanks to you for staying throughout the whole video. In my practices, we worked what I called a straight 7. It's far more productive than traditional scheduling. Schedule 7 hours straight. Now, if there's a cancellation or no-show, that's your lunch hour. If everybody shows up, you grab what you can when you can. You'll have a shorter workday, and you'll be more productive than you can possibly imagine. Now, if your state requires a meal break, ask your HR attorney if perhaps you could open at 11 o'clock until maybe 8 o'clock at night, breaking at 3 o'clock in the afternoon, which is a tough hour to fill with patients anyway. More about patient-centric scheduling as we continue this series. What do you do that wows with patient centricity? Let me know in the comments below. If you're a general dentist and you'd like to be part of our community of dentists around the world, sharing gems to improve patient care, have more fun, and make more money, we'd welcome you to join our free Facebook mastermind group. It's called Dental Goldmine. There's a link in the description below. Just a reminder, if you're watching this before Thursday, April 30, join my free live webinar, Your 6-Week Plan for a Rapid Recovery. There's a link in the description below. I'm going to continue to work really hard on this series, but during the 90-minute live event, you'll get a ton of gems that you'll need for recovery, all in one sitting. Now, if you missed the live webinar, it's okay. You can watch a replay for free. Elizabeth and I would be delighted to have you with us for a free test drive of GEMS Platinum membership. Go to dentalgoldmine.com. There's a link in the description below. When you start your free test drive, tell your concierge you want access to the 90-minute 6-week rapid recovery webinar. During the next video in this series on rapid practice recovery, I'll share several more ways you can make your schedule more patient-centric. I hope this has been helpful. If so, please click like and let me know in the comments below. Thanks for joining me here in the Dental Goldmine. Stay safe, stay healthy, and remember, you're only one gem away.